Good afternoon. I'm Donde Plowman, Chancellor here at the University of Tennessee, Knoxville. I am joined by Provost John Zomchick and Dr. Spencer Gregg, the physician who oversees our Student Health Center and is also director of the Acute Care Center. He's been serving as the incident commander for our campus emergency operations in response to COVID-19. This is the first in a new approach to trying to communicate and update our campus family about what's going on with COVID now that we're bringing students back to school. Each of these is intended to be around no longer than 30 minutes. Today's, the first one may go a little bit longer. We've got quite a bit of information we want to communicate quickly, but we'll be doing these twice a week, Tuesdays and Fridays at 11:30 Eastern Time, and we invite anyone to join us. I know many of you have questions as we start the fall related to our campus operations during the pandemic, and we want to provide these updates regularly to share the latest information related to COVID and our response. We just provided a similar update to faculty and staff a few minutes ago, and there will be some overlap in the information we provide now. We wanted to do two of these at the outset so that we could tailor some of the information to specific audiences, this one for students and families. First thing I want to do before we launch in is take a moment and talk about why are we, because their families want them to return. We're a land-grant institution. We don't think students in Tennessee or the neighboring states where we draw students from should have to put their aspirations of a college degree on hold, waiting for a pandemic that we don't know how long we're going to have that as part of our experience. An important part of getting an education is the experience of learning to be independent, making new friends, experiencing different viewpoints, and building lifelong relationships. All of those are experiences that take place outside the important experience of the classroom. As we're getting ready to discuss, we're taking many precautions, everything we can think of, honestly, and making significant investments in health and safety measures, as well as technology and how to use it to build dynamic and engaging curriculum. If we don't answer your question today, it doesn't mean we won't. We will continue doing these updates twice a week, and we will archive them on the website. So let's talk first about campus data. Where are we? The question we receive most from students, staff, and faculty is, what is the threshold we would use for going online in the spring? There's no one single answer to that, but I want to show you some data that is available on the website and that will be very important in our considerations. We are tracking, first of all, active cases. So what you see here is we look at the number of active cases split by students and by employees. So right now what you see is we have a total of 28 active cases. 20 of them are students and 8 of them are employees. And you will see that tracked over time. We also track the number of people who are self-isolating. We break it down by students who live in residence halls, students who live off campus, and employees. What you see here is the gray is employees. August 12th, August 13th, that shows the number of employees who are self-isolating. The blue is the number of residential students, those that have moved into the dorms, and those who are non-residential students who are self-isolating. And let me just talk a little bit more about other metrics. We also, let's talk about isolation spaces. So we have, let's talk about self-isolation. So what you see here also is the reasons. This is another thing that we're tracking, the reasons that students are self-isolating. And we break it down by students who live in the residence halls, students who live off campus, and employees. Part of what we look at to make decisions about campus operations are our ability to isolate and quarantine any student, and as well as our contact tracing ability. So what you see here on this chart is showing, as of today, of the people who are self-isolating, 38% of them are self-isolating because they've been identified as a close contact with someone who has tested positive. You will see in the green area, 32% of the people self-isolating are people who have developed symptoms. The red is for people who are isolating because they have received a positive test result for COVID-19. And then there's another other category. So let's talk for a minute about what does it mean to isolate. An important factor for us in considering how we're doing on campus is, do we have spaces for students to isolate in? We've contracted with nearby apartments and hotels to add isolation space, and we made living campus optional for first-year students for the first time ever. So our residence halls overall are at about 85% full. There are some dorms, the dorms that have the largest number of students, who are only 75% full. We reduced the capacity dramatically in these halls that have more sharing of bathrooms. Reduced residence hall capacity will give us the flexibility to add isolation space as we need it. Students living in the dorms may need to move spaces throughout the semester, and they know that and have been informed of that. Of the people self-isolating, we further break it down to track whether they are isolated, as I said, because they have a positive test, are symptomatic, or an asymptomatic close contact. And we will keep this information all on the website that is available for people to see on the coronavirus website at any point in time. Other considerations that will be important to us and inform our decisions: our ability to perform needed testing on campus. And Dr. Gregg and others are working closely with the Knox County Health Department, the contact tracers there, our other staffing and services at the Student Health Center. You're going to hear more about that. But first, let's start with, what should a student do if they don't feel well? So Dr. Gregg, I'm going to ask you to take that question on.
Thank you, Chancellor. I appreciate the opportunity to be with you and the Provost today to provide this additional information to our students and their families. Students are encouraged anytime that they feel ill to contact our telephone triage nurse line at 865-974-5080. And anytime that they feel like they need to see or speak with a healthcare provider about a particular health concern, they should always, their first point of reference should be our triage line. Our telephone triage nurse will talk to the student about their health concerns and establish a plan for their evaluation and care. The nurse can provide the student with helpful self-care information, and if necessary, advise the student to even be seen through the ER if their symptoms so warrant. The telephone triage nurse might also advise the student to schedule an appointment at the Student Health Center for further evaluation and care. If so, the nurse will assist the student in scheduling that appointment. In accordance with current CDC guidelines, students will only be seen by appointment through the Student Health Center. Walk-in appointments are only available at clinics designated for that purpose, such as walk-in clinics or urgent care centers, or through the ER. But even at those facilities, the CDC advises that anyone who's concerned that they may be infected or that they know they're infected with COVID-19, they should always call ahead before going so that those facilities can be adequately prepared to protect their staff and other patients. I'd like to talk to you a little bit about self-isolation, our self-isolation form, and how that works. Every day before coming to campus, or if the student resides on campus before getting out on campus, students should complete the daily health self-check app, and that's accessible online or through the UT app. Upon completing the app, the student will be advised if it's okay to be on campus, or if they should stay at home or in their residence because of their symptoms, or maybe because they're at increased potential for a recent COVID-19 exposure. If advised not to be on campus, the student will be provided a link to the self-isolation form. The self-isolation form, once submitted, informs our contact tracing group to reach out to the student to assist them further and to advise them on their next steps. It's likely that almost every student will have to complete this form at least once during their semester, and some even more than once, but that's okay. This is a way that we're able to assist those in need and protect others from potential exposure. Completing the self-isolation form when needed is key to our ability to successfully complete this semester's on-campus experience for students. The online self-isolation form should be submitted anytime that you're advised to isolate or quarantine, which may be based on having developed symptoms that are maybe suggestive of COVID-19 infection, anytime you're awaiting a COVID-19 test result, if you've received a positive test result, if you've been identified as a close contact, or other potential exposures. That self-isolation form needs to be completed. Our testing capacity at the Student Health Center has also increased. We've made an intentional effort to increase the availability of testing on campus, particularly focusing on the Student Health Center's capabilities on those who reside in on-campus housing. We've contracted with 3 separate reference labs across the state to constantly assess where we're able to have the quickest turnaround time on test results. We're also in the process of purchasing a rapid test capability for our Student Health Center lab. In addition to these resources, students will also have access to other community resources for testing, such as their primary healthcare provider's office if they happen to live off campus in the community, a local walk-in or urgent care testing site, the Knox County Health Department, or a local ER if symptoms should warrant. I wanted to also give you some information about the Student Health Center contact tracing program, plus our additional staffing and expanded hours for our students. The Student Health Center has expanded our service hours and staffing to accommodate an anticipated increased student demand this fall semester. More information regarding our hours and services is available on our website. We've also added additional staff to accommodate our contact tracing and campus health surveillance programs on campus. Additionally, we've teamed with a local health service company to provide an after-hours nurse advice line for students to call if needed when the health center is not open, similar to what's available to you through your healthcare provider's offices at home. A little bit more about surveillance testing on campus and how that will work. You're likely aware that we'll be performing campus health surveillance on campus. Our campus health surveillance program first includes completing the daily health self-check app that pertains to symptoms and exposure risks. And then, if indicated based on your answers on the app, completing the online self-isolation form. The second part of our surveillance includes surveillance testing. This includes both wastewater and saliva testing of on-campus residential sites. If indicated based on particular circumstances, the surveillance testing may also be expanded to include other exposure-prone groups or sites on campus. Occasionally, some students in certain on-campus residential sites will be asked to provide saliva samples for testing. Kits and instructions will be provided for that purpose. Students that are identified in a positive saliva pool will be requested to have further COVID-19 assessment through the Student Health Center and to quarantine while we are awaiting their official test results. Once the individual results are back, the Student Health Center will reach out to the student to let them know the results and provide guidance on their next steps.
We've spent millions of dollars to maximize the safety and to engage our students in difficult times. And some of the most effective measures that we can all take include masking up and spreading out. So Dr. Gregg, can you talk about how masks work to protect us?
Certainly, wearing a mask is important to further reduce your risk of exposing others to COVID-19 should you be infected and just not be aware that you're infected. Since we know that persons with COVID-19 can be asymptomatic and still spread the infection, we should all assume we might be infected. Wearing the mask demonstrates our concern for the health and safety of others. Some studies have also indicated that wearing a mask may also provide the wearer some degree of added protection to exposure. So wearing the mask also demonstrates our desire to remain protected and healthy ourselves.
We've received a number of questions from students, faculty, and staff about masks and about the protocols for enforcing mask wearing. Masks are required in public spaces on campus. That includes classrooms and common areas. Faculty can ask students to leave or even not hold class if a student is not wearing the mask. Staff also interact with students all over campus, and they have the same ability to control whether they interact with students who don't wear face coverings. We don't want to create the mask police. We do want an environment where we can respectfully keep all of us accountable. We want people to ask nicely and provide unused masks if they have them. We will also keep extra masks at the library, at the union, and other spots in the event that someone forgets, as I'm sure that's going to happen. Students who repeatedly refuse to mask up can and probably will be referred to student conduct. We also received several questions related to the use of gaiters in light of a study out of the Duke University very recently. It was just been released, I think, a few days ago. Ultimately, we will take our cues from public health officials. We work here very closely with the county health department. And if they tell us gaiters should not be worn, we will follow that guidance and let everyone know that. Provost Zomchick now is going to provide information about classroom preparations and some safety precautions there.
Thank you, Chancellor. Good afternoon, ladies and gentlemen. Talking to the students now, if you haven't done it yet, please go to Canvas and take the training for the Return to Campus. It has a lot of great information for you about what you can expect during the first days, and will certainly help you navigate a campus that looks different from the way it was during the spring. As you return to the classroom, you'll notice more differences. Furniture has been removed from all of the classrooms or taped off in order for us to preserve 6 feet of physical space between each student. Your instructors have been told to create seating charts to aid contact tracers in the event that that becomes necessary. What that means for you is that you need to pick a seat when you enter the classroom for the first time and keep that seat for the remainder of the semester. All of the rooms have been carefully measured and the furniture deliberately placed. It's important that you do not move the furniture, either in the classrooms or in the common areas, and especially in dining facilities where you have to remove your mask to eat. As indicated in the Return to Campus training, you should not eat or drink in class during this semester. Also, there are enhanced cleaning protocols across campus, and there will be wipes available for you to wipe down your classroom space before you sit down. That includes your desk or other hard surfaces that you may touch while you're in the classroom. You will also see big orange hand sanitizers near the classroom and throughout the campus. Please use those. If someone on campus tests positive, contact tracers will reach out to anyone who could be a close contact. Please cooperate with the contact tracers. They are on the front lines of keeping the virus from spreading. Dr. Gregg, this is a question for you. How are we accounting for social distancing during class transitions? I can start off and answer by saying we've increased the amount of time between classes, and also we've created physical distances in the buses, and the buses will be running. The key to any of this, however, is to keep social distancing and not be a close contact. Can you talk about what not being a close contact means in class and during those transitions?
Certainly. We define a close contact as someone who's within 6 feet of someone else who's COVID-19 positive for more than 10 minutes, whether or not they're wearing a mask. If you can be identified as a close contact, it means you're going to be requested to submit the self-isolation form and quarantine for a minimum of 14 days. Those in quarantine may not attend class or work or be out with others. They can attend class virtually. If you don't want to quarantine away from others for 14 days, then you don't want to be a close contact. That means you need to stay at least 6 feet away from others whenever possible. And when unable to maintain that 6 feet of distance, make sure it is always for less than 10 minutes. And remember, you further reduce your risk of exposure to COVID-19 by wearing a mask.
So the point is, don't become a close contact. And that's hard because all of us, and especially students, we come to campus to connect with one another. Our Division of Student Life and Dean Shea is working really hard to create fun and meaningful experiences for you outside the classroom. There will be virtual, hybrid, and in-person events, just like in the classroom. We're also trying to maximize outdoor space. You will notice hammock stands. There's about 75 of them across the campus. So you will have a place to hang your hammocks, to engage in classes or hang out of doors. It's a really safe place to be. We will be putting up tents on the campus so you can bring lots of activities or activities outside with masks and socially distanced. We want to provide you fun opportunities to connect on campus so you don't feel the need to go party off of campus. I know it's hard, and these connections are so important to the college experience, but just remember, it's important to protect people and protect your ability to maintain a campus experience. And hard as this is, it won't last forever if we all do our job. Now, here are some of the tough things. We have questions about fans in Neyland Stadium and whether tailgating will be banned. We don't know what will happen with football yet. We're hopeful the team will get to play. If they do, it will not be to a full stadium, and there will likely be significant reduced capacity. If we do play football, we won't have tailgating on campus. Football has no bearing on whether or not classes transition or move to online. As noted earlier, that depends on case counts, like we showed you, on our ability to manage through contact tracing, through isolation, and available hospital and testing capacity. There was also a question we got about fraternities and sororities. Vice Chancellor Cuevas has been having some very difficult conversations with our Greek leadership. If houses violate the social distancing rules, there will be significant consequences for the chapter who does that.
Chancellor Dr. Gregg, one of the questions we received is about surviving isolation if you have to quarantine for 14 days. I know from an academic perspective, students will be able to engage remotely and work with their professor to join the class remotely to the extent that they feel up to it, or catch up after they feel better. Dr. Gregg, can you tell us what a student in quarantine should be prepared to expect?
Sure. What to expect in quarantine. The university has secured for on-campus residents special temporary housing sites, both on and off campus, for isolation of those infected and quarantine for those at increased risk of infection. Completing the online self-isolation form is how we know when that service may be needed. During your time in quarantine or isolation, you can still attend classes virtually. Meals will be delivered to you, and representatives of the contact tracing program or student health center will have daily contact with you to check on your health. The question that we often get is, how long will I have to stay in isolation or quarantine? And by definition, if you're placed in quarantine, you'll be there for a minimum of 14 days. If in isolation, the duration will depend on your symptoms. At a minimum, an isolation can be expected to last at least 10 days. Representatives of the contact tracing program or student health center who are having daily contact with you will advise you when you may end your quarantine or isolation and move back to your regular dorm space.
Before we close, I would like to address the questions we've received regarding tuition, fees, and housing costs. As it relates to housing and dining, we're trying to be flexible. We have reduced those costs by 10% since move out will be happening before Thanksgiving. If we have to move out of dorms suddenly, or if we have to do it early, you will receive a refund for any unused days. If students move out of the dorms, whether that is an individual decision or a campus necessity, any unused housing time will be refunded. This semester will be different, but faculty and staff are ready to engage with our students, teach them, challenge them, work with them, keep them on track towards their degree. We've invested not just in technology needed to help that engagement, but we've also invested in the continuing education for our faculty to best use this technology to provide excellent teaching and learning this fall. We've programs planned for students, and we're planning things in multiple modalities so students can choose whether they join in person or online. All of that is to say, If we have to pivot and go online fully this semester, we may look at how we can discount further. It's not something we are currently looking at. I know we still have questions left to answer, and we will work on pulling that information together. Starting next week, we will provide updates on Tuesdays and Fridays at 11:30. All of these updates will be archived on the Chancellor's website at chancellor.utk.edu. I want to say how proud I am of our entire campus community. This is not easy for anyone, and it will take all of us wearing our masks, spreading out to stay on campus and get some of our normalcy back. We can do this. We will continue to work to keep our community healthy and hopeful, keeping students on track to graduate, and we will lead with compassion, creativity, and flexibility. Thank you.